Let's start with the ones that were shocking and work our way towards the ones that were insane. Number 10, haircuts. Now, you're probably wondering, how on earth can cutting hair even be on the list? No, there wasn't a weird or disgusting method that medieval barbers used to cut hair, or anything like that. Instead, the thing that was disgusting were the haircuts themselves. Surprisingly, haircuts were seen as a status symbol during the medieval period and were a quick way to identify a person's social ranking. This meant that a peasant couldn't just walk into a barber shop and request a hairstyle reserved for nobles and kings, since that would have instantly made him royalty. But let's cover some of the strangest haircuts from this time period so you can see exactly why this belongs on the list. Let's start off the tonsure haircut. This haircut was given to priests, monks, or any religious man to symbolize their commitment to their faith. Obviously, a timeless hairstyle that is still worn today. The Norman haircut. This was a practical haircut worn by knights and soldiers that made wearing chainmail under their helmets a bit more comfortable. The cropped bowl cut. This wasn't your typical bowl cut we all got as a child. This was cut a bit higher up on the head and was a hairstyle so popular that it transcended social classes. Then of course there was the medieval bob, the beaver tail, the big boy bowl cut, the zazzera, and of course the bald cut, which was popular among those crawling with lice. Number 9, enemas. Enemas are an injection of fluid directly into a person's back door. In the early medieval period, enemas were created using a tube that attached to an animal bladder, which was hand squeezed to pump the liquid into the patient. But eventually, a tool called a clister was invented. The most common mixture used from ancient times through the medieval period was salt water, which was believed to relieve constipation and work as a disinfectant. Water mixed with chamomile, rosemary, wormwood, marshmallow root, and many other herbs were also very popular. But sometimes these herbs were mixed with wine instead of water, which made the appointments a lot more enjoyable. For those who needed something a bit stronger, they were basted with pure vinegar or wine, which was believed to cleanse a person's intestines, align the humors, or cure internal rot, which is obviously caused by crossing the lake of rot. Another popular mixture involved being pumped full of olive oil or animal fat, which was meant to lubricate the intestines and soften stool, allowing it to flow freely. Then there were broth and milk enemas. These were given to weak patients who needed nourishment, which we have to give them credit here. They were so close. Wow, that smells amazing. Oh yeah? Nah, it's pretty good. It's actually my grandma's recipe. Oh, that's awesome, man. You want to try some? No, it's okay, man. Thank you, though. Thank you. No, seriously, it's my treat. Well, if you really don't mind, it does smell really good. Don't be silly. Of course not. Number 8, incision and drainage. Well, that was quick. And just like that, we take a dark turn. During the medieval period, if you were unlucky enough to have a boil, an abscess, or really any real swelling of any kind, you would go see your doctor, who would have pat you on the back, turned you around, and sent you in the direction of a barber surgeon. After all, the reason barber poles are red, white, and blue is to symbolize blood, bandages, and veins, letting the public know that surgery was performed inside. Unlike doctors, barber surgeons were very skilled in handling blades and were hands-on with many different procedures, as you will soon see. Let's cover the 2 types of ailments or symptoms that would have required you to be drained like a can of beans. Boils. If a patient showed up with a boil, a barber surgeon would check for the following. Is the lump painful? Is it enlarged? Does it have pus? Yes to any of those questions was good enough to begin draining. This was done based on the belief that releasing pressure would prevent the infection from spreading deeper into the body. Abscesses that looked infected were another common condition that required drainage. Here, the barber would check the following. Did the area feel hot? Was it red or tender to the touch? If so, it was considered ripe for incision. Then of course, any injury or swelling that looked infected would also be drained. The procedure often made things much worse, leading to deadly infections, sepsis, gangrene, or death. Today, we all know that the unsanitary blade was the most dangerous part of the procedure. Number 7, broken bones. During the medieval period, broken bones were adjusted using the best technique available at the time: eyeballing. If someone came in with a broken arm, a barber would first diagnose the patient by touch, squeezing and feeling around before deciding, yup, just like I suspected, it's broken. This is when the barber would manually adjust the bone back to its original position the best he could, before bandaging the limb to a wooden splint to keep the bone in place. This is what that would have looked like. Around the 2-week mark, the patient would return to have a cast wrapped around the broken bone, made of cloth soaked in wax, clay, or wet flour, which would harden and further immobilize the injury. And around the 10th week, the cast would be removed, and if the patient was lucky, he would have a healed and straight bone to rehabilitate. But of course, that wasn't always the case. Crooked bones were very common and often resulted in lifelong crooked limbs or disability. But one of the most painful scenarios was when a patient suffered broken legs that didn't heal properly, resulting in them living the rest of their lives as a short king. Number 6. Bloodletting. Bloodletting was when a person had blood intentionally removed from their body, either through an incision or from the use of leeches. The sicker a patient was, the more blood was removed. If the patient had blood removed but their symptoms didn't improve, well, that simply meant they didn't drain enough. Blood was removed based on the belief that illness was caused by bad blood in the body. But sometimes, if a barber suspected a patient of having too much blood, yeah, that called for a draining as well. I know what you're thinking. What symptoms would you have to be seen as having too much blood? Well, any of the following: red flushed skin, fever, inflammation, headaches, dizziness, nosebleeds, bleeding gums, or simply being in a bad mood were all considered signs that you were hoarding blood. These were the most common locations for bloodletting. Yes, I know. Now, the good news was that those who had money could pay for someone to come to their home and place leeches on them, which was a painless form of bloodletting. Some even went as far as saying it was relaxing, which meant it carried the risk of accidentally falling asleep and waking up at low HP. Number 5. Cauterization. Here, a patient who was severely injured and losing blood was brought into the barber shop, where the barber would take a red-hot iron tool and press it directly onto the patient's open wound, applying constant heat until it formed a golden brown mahogany crust with a slight char, then waiting 5 minutes for the juices to redistribute before enjoying. If the barber nailed the crust, it should have stopped the bleeding, hopefully saving the patient's life. But sadly, oftentimes the pain was so agonizing that patients simply died from shock. Really quickly, let's cover the most common spots where cauterization was used, and you'll see exactly why people passed out or died from the pain alone. Hemorrhoids. Yeah, you know what, I'm good. We could just end it there. Number 4. Tooth extraction. Another skill barbers had to master was tooth extraction. Now, surprisingly, tooth decay and infections were not as common as they are today, since refined sugar was rare and expensive. Nobility were more likely to suffer from tooth pain caused by cavities, since they were actually able to afford sweets. But the majority of teeth extraction still came from peasants and commoners, not from eating sweets, but because they cracked their teeth eating stale bread. Those who could afford fresh bread easily avoided this problem, and instead cracked their teeth on small rocks, since flour was commonly ground with stone mills that frequently chipped. During this time period, tooth pain was believed to be caused by tooth worms, so to drive them out, people tried the following: holding their head over an open flame, holding their heads over smoke, and the scariest one, applying heated metal directly to the tooth. But once they realized that none of these worked, they eventually arrived at the barber shop in hopes of finding a permanent solution. If the pain was subtle, you might get something like an herbal tincture made of garlic, vinegar, sage, and wine applied to the outside of the jaw, which obviously did nothing but make you smell like an uncooked piece of chicken. If you walked in with severe tooth pain, then you could expect absolute hell. Tooth extractions were one of the most common procedures and were quick and brutal. The barber would use either a tool called a pelican or a plier-like instrument to yank the tooth out, trying his best to not break the patient's jaw. And as the patient screamed in agonizing pain, a hot iron was thrust into the mouth to cauterize the wound and stop the bleeding. That was the moment many realized it just wasn't worth it, and simply passed away. Number 3. Cataract surgery. Couching was a procedure in which cataracts were treated by displacing the cloudy lens inside the eye. Now, I know that might sound confusing if you're not an eye doctor or surgeon, but don't worry, I've done my research. After watching an eye doctor explain all the parts of the human eye, I can confidently say, I now know as much as he does. When a person has cataracts, the lens inside the eye becomes cloudy, which prevents light from being properly focused onto the retina. This can cause blurry or dim vision, glare, faded colors, double vision, or if you're really unlucky, complete vision loss. Really quickly, to fully grasp how devastating the medieval procedure was, you first need to know the basics of what this surgery looks like today. First, the eye is numbed with eye drops. Then a tiny incision is made in the cornea. The cloudy lens is then broken up using ultrasound, removed, and replaced with a clear artificial lens. An easy procedure that only takes 10 to 20 minutes. Now that we're all eye doctors, let's talk about what would have happened if a person wanted to remove cataracts from their eyes during the medieval period. A person walks into the barber shop. No, a barber shop. Okay. Since there were no painkillers or numbing drops, patients were instead tightly tied down. The barber would tightly hold the eye open with one hand while inserting a sharp, needle-like tool through the cornea. The cloudy lens was not removed. Instead, the lens was pushed into the eyeball as if it were a trash bin. An easy procedure that only takes 10 to 20 minutes. Sadly, only about 10 to 20% of patients actually received partial vision restoration, since the majority got eye infections or lost their eye completely, since tools were not sanitized during this time period. Number 2. Trepanation. Trepanation is when a hole is surgically made on a person's head. These holes were manually drilled or sawed into the skull in an attempt to treat various illness or relieve symptoms. You're probably wondering, what type of illness would call for a hole in the head? Well, I'm glad you asked. If a person had seizures, convulsions, paralysis, psychosis, depression, hallucinations, migraines, headaches, being crazy, insane, or showing erratic behavior of any kind, those were all good enough reasons. Holes in the head were believed to release excess pressure. Another common belief was that the hole would allow evil spirits trapped in the skull to be freed. Here, a barber would take a sharp, arrow-like tool and place the sharp end on the patient's head, then quickly rotate it between his hands to drill into the person's skull. Again, without anesthesia or painkillers, the procedure was excruciatingly painful. It also took hours to complete, since multiple holes were sometimes drilled. But after the procedure, the person would have a moment to catch their breath before things only got worse. Since the person suffered an agonizing hole on their head for up to a year as it slowly healed. Well, that's if they even lived, since many patients died from infection shortly after. Number 1. Amputations. Amputations were among the most painful and deadliest procedures that barber surgeons performed during the medieval period. The most common reasons for amputation were injuries sustained by soldiers or complications from infection and gangrene. But let's talk about how the procedure was done. Let's say a soldier came into the barbershop from battle with a mangled arm. He would have been seated and restrained, either with ropes or by multiple assistants. The limb would then be tied off with a tourniquet to slow the bleeding. Then the speed run would begin. The barber would cut the skin and muscle using a knife or scalpel, then saw through the bone with a bone saw, chisel, or in an emergency, an axe. But for those who lived long enough to see their limb tossed in the trash, their wound would then be cauterized with a hot iron to stop the bleeding. The stump would then be wrapped with bandages soaked in wine or herbs before being sent home to recover. Many didn't. Since you guessed it, they died from infection shortly after. Hopefully watching this video made you appreciate modern medicine and how lucky we are to be alive today. But for those who need a bit more convincing, I'll just leave you with this. Today, if you were at the hospital with a knife impaled in your thigh, they'd simply take a second knife to cut around the meat, then use that same blade to pry out the first. No need for amputation. That's modern medicine.